Okay, welcome to our egg freezing live webinar in this beautiful Friday night. This is our reproductive endocrinologist, Dr. Zayton.
Hi, I'm Khaled Zaytoun.
Hi, I'm Miranda, patient coordinator. So in this egg freezing webinar, we will first introduce global fertility, then Dr. Zayton will go over some questions like what is egg freezing, the whole process, and what kind of people should consider to do the egg freezing. So, and also I will interview Dr. Zayton with the most popular questions that usually patients have about the egg freezing. At the same time, if you have a question about egg freezing, you can type and send it to Instagram. Okay, so let me introduce Global Fertility first. Global Fertility and Genetics is located in Midtown Manhattan. We are not only a reproductive fertility center, we also have our top level lab with CLIA and a CLAP license, and we also have the tank storage room to freeze your egg. So with our experienced team, we can guide you through the whole egg freezing journey. Okay, so Dr. Zayton, can you tell the patient what is egg freezing?
Egg freezing is a way to preserve fertility or preserve your eggs. As soon as we freeze something, we stop time. A woman is usually born with all the eggs she will have all her life. No new eggs are being made. This is different from a man who makes sperm all the time. Women were not supposed to get pregnant when they're later in life. But now that we live longer, we have more active lives, we want to extend our fertility potential. So taking out some of those eggs that will disappear by time will preserve them to be used in the future to have a baby.
Yeah, like what kind of people you think they should consider to do the egg freezing?
Well, anybody who wants to have a baby either in the future or does not know if they want to have a baby, but they might want to have a family, should consider egg freezing if they're not ready to get pregnant at an appropriate time.
Okay, so I will tell everybody, so to let everybody know, whoever attend this egg freezing webinar today, if you consider to do the egg freezing within 1 year, we have our discount fee schedule. It's only cost $5,500. You can apply. So we also provide the loan program. So you can do your egg freezing today, you can pay the fee in future. Okay. So let me interview doctor with some common questions that patients usually have. So if I want to do egg freezing, I make a decision. What should I prepare? What kind of exam I need to do before I do the egg freezing?
Well, we start with a consultation.
Mm-hmm.
We do a full exam to make sure you are healthy. We will also run some blood tests to exclude certain problems and make sure that you are ready to do the procedure. We have a blood test called AMH, which will give us some idea about the number of eggs available to be stimulated. It gives me some idea about what we call ovarian reserve. When I have a good number on the AMH test, which is usually between 1 to 4 nanograms per milliliter. This means that when I give medication, I will get a good amount of eggs to freeze.
Yeah, so you talk about AMH. What is AMH? Like what, if I'm 20 years old, what is my AMH supposed to be? If I'm 40 years old, what my AMH looks like?
Well, the AMH, there is no certain number for each age. We have the most common numbers are between 1 and 4 in the reproductive age. There might be young patient with decreased ovarian reserve with less eggs available. Every person is different, and there might be a patient over 40 with a very good AMH and very good egg reserve, which is all genetically determined. AMH will help me to guide how much, give me some idea about how many eggs are available to be taken out of the body and frozen. But there is no certain number for each age.
Okay. So we talk about the medication when we're doing the egg freezing. So what kind of medication patients really do? They take a pill or they get the injection?
Naturally, the woman matures one egg or maybe two every month that will go on to ovulate. When we do a procedure like egg freezing or IVF to get pregnant right away, or even freeze embryos, we need more eggs than the body naturally makes every month. For this, we give some medication. The medication can be oral pills, but the most common medication is a hormone called FSH. FSH is the natural hormone that will stimulate your ovary to make the eggs grow. And in that case, we sort of take over the controls and make the ovary make much more eggs than it usually will. The more eggs we will make, the better chance we have at achieving a viable pregnancy in the future.
Okay, so like if I want to make to do the egg freezing, how many days do I need from the first day of the injection medication until the egg retrieval?
Usually the cycle takes, or the treatment cycle takes, about 8 to 12 days of injections. Sometimes it gets slightly longer, but that's the average time. So after the start in 2 weeks, we will be usually obtaining the eggs.
So we have one patient ask, she's 42, and do you think I still have an opportunity to freeze my eggs?
Anybody can have an opportunity to freeze eggs. It will really depend on the reserve in the ovary and the history before, if you had any stimulation in the past. Obviously, when you are over 40, the ovarian reserve is usually less, but also the egg quality, and the egg quality means the chromosomal complement of the egg. If the egg is normal chromosomally or not. The normal eggs are less. In that case, we might need to get more than one cycle done to get enough eggs.
Okay, so one more question. Hi, doctor. I'd like to know, where will my eggs be stored after they are frozen?
Well, we have a storage facility at GFG in our center, and we can keep the eggs over here. Some patients will keep the eggs in a long-term storage facility if they intend to keep the eggs, frozen for many years.
Yeah. So we just talk about patient need 12 days, almost 12 days to do the egg freezing. So during the 12 days, can they go to work, or they have to stay at home?
Sure, we don't really tell the patient that she needs to take off work because most of our patients are working. They have busy schedules, and we usually will accommodate the patient according to her working hours. We can see them early in the morning. Sometimes we see patients later on in the day, depending on their schedule. It's very important. Work is very important for all of us, and we try to keep you in the job.
Yeah. So it's not that you have to stay at home. You can do what?
No, the only day we advise you to rest is the day we retrieve the eggs themselves, because you will get heavy sedation at the time of retrieval, so you don't feel any pain. And that day we would advise you to rest and stay home.
Yeah, so one question from patient. How many years egg could be freezed?
Well, theoretically, we can freeze the egg indefinitely. There is no number of years that we know that will damage the egg. So as soon as the egg is frozen, as long as everything is maintained well, the egg can stay there forever.
Okay. So patient asks, should I need to do multiple cycles?
The question would be, how many eggs do I need to have a good chance at having a baby? And the second question is, how many babies do I want? A patient that's less than 30 years old, I think 10 eggs frozen will give you a very high chance of having a baby. Between 30 and 36, probably I would love to freeze 15 to 20 eggs. Over 36, I would like to freeze 20 eggs or more.
Yeah, okay. So one more question. Can we show patient how the egg is frozen in like what kind of tools?
We use the freezing method we use is vitrification. Vitrification means we freeze the egg very quickly before even it can make ice crystals, and it's frozen at less than 190 degrees centigrade. After this, we actually will freeze the egg in a straw. This is a small tube where we have the egg in, and the tube is labeled with your name, with the date, and we will be able to retrieve your egg back. So as soon as the egg is frozen in the straw, it will be stored in a liquid nitrogen tank.
Okay. So patient also asks, is the egg freezing procedure painful?
Well, the only day there is some pain is the day when we take the egg out, but the pain is not severe. You usually get some mild cramping after the retrieval itself. We usually keep you in the clinic for about an hour to make sure everything is fine, and usually we'll go home, and the pain medication you need today, but we would like you to go home, not work that day, and rest.
Okay. What if I don't use all of my frozen egg?
Well, if you are going to use the eggs at some point, we usually will fertilize all the eggs that are there unless you have a tremendous amount that is frozen. And then we will use the embryos that you need. If there are extra embryos or extra eggs that you did not use, you have an option to discard them, or you have an option to donate them. It will be completely your choice.
Okay, so since we talk about medication, can you show patient the injection pen, how it looks like? Because most patients say, I'm scared.
Well, this is one of the injections for FSH. It's called GONAL-F, and there is a small needle attached over here, which we attach over here. The medication is in this area of the cartilage, inside the cartilage, and we will attach a very small needle to the end. We will dial your dose over here, and then you usually will inject yourself. The needle is very small. You will choose the injection site. Usually it's in the abdomen in the fat, and you will put the needle in and inject your medicine. And the medicine will go inside where it's supposed to go. It's a very easy way to inject. Sometimes it's scary to think about it, but as soon as you've done it once, you will be feeling very comfortable that it's not painful. And we usually will have a training course to show you how to take the shots, and our nurses will guide you through the process.
Yeah, so not scary.
Not scary at all.
Yeah. Okay. So, well, I think patient have more question. Will egg freezing decrease my chance of receiving naturally someday?
No, it is not known that egg freezing will decrease your chance. Many patients that will freeze eggs sort of for security in the future in case they want to get pregnant, can get pregnant naturally on their own and might not use the eggs that they froze. We know this from donors that donate eggs. We have donors that do several cycles of donation, and when they want to have their own baby, it is easy for them to get pregnant.
Yeah. Okay. So If the medication have any side effects, it can make me getting fat or any
Well,
side effects.
any medication or anything we do can have some side effects. During the egg freezing cycle, you will inject the medicine. We want more eggs in the ovary, so the ovary will enlarge. This can cause some slight bloating or some slight discomfort at the time the eggs are growing, and a little discomfort after they're taken out. Some people are very sensitive to the medicine and they get something we call ovarian hyperstimulation. If the ovary gets hyperstimulated, which means that the ovary is growing eggs a little bit out of control, we do monitor that, and if we find out that the estrogen is too high, we will decrease your dose so you don't get sick from that. Very rarely, 1% of patients will get the ovarian hyperstimulation syndrome that will make her get sick after the retrieval. She will get bloated, the belly will get a little enlarged, and sometimes will accumulate some fluid in the belly. This process will go away completely, after treatment or after the cycle is done. We have many ways of preventing the hyperstimulation syndrome. Some of the ways are by giving certain medications to induce the ovulation, different from the medications we gave in the past, so we don't get this big reaction from the ovary. And freezing the eggs and not getting pregnant that cycle will also prevent ovarian hyperstimulation.
Yeah, so let's see one more question from patient. Like, how long will it take for the egg retrieval procedure?
The egg retrieval procedure takes about 10 to 15 minutes. And at that time you will be asleep, you'll get sedation, and you will not really be feeling anything.
Oh, okay. So how do I know what I am a good candidate for the egg freezing?
Well, we usually do a consultation, we do a sonogram, we look at the small follicles in your ovary, which gives us some idea about your response to medicine. We also get a test called AMH that will tell me a little bit about the ovarian reserve. Good candidate, bad candidate is not really, there's no really good or bad candidate. It depends on what you want to do. So some people will need one cycle for egg freezing and they'll get a lot of eggs. Some people will need more than one cycle, but we try to get everybody enough eggs to give them a good chance of having a baby.
Yeah, okay. So patient also ask what injections will be used. Maybe we can show them again.
Yeah, I mean this
More
is
people joining, they didn't see it.
Yeah, this is one of the ways of giving the medication. It has the medicine inside this chamber here, and a small needle is attached here. This area, we dial the dose. The medication is called FSH, which is a hormone that stimulates the ovary to grow eggs. And we get this medication daily, probably for around 8 to 12 days till the eggs are mature. We know that the eggs are mature by doing sonograms and blood work before we decide the day of retrieval.
Okay. So one more patient joining, so we have more questions. So how many eggs should I aim to freeze in total to have a better number?
This really depends on your age. If somebody is between, let's say, 25 and 35, we probably would love to freeze 15 eggs for you. Over 35, it's better to have some more eggs, maybe 20 eggs or more. If you're over 40, we also want to freeze around 20 eggs.
Okay. So after I get retrieval, when will my period return after the egg freezing?
Usually the period will return 2 weeks after the retrieval. It will be like a regular period, and your period will go back to normal after that.
Okay. So am I likely to need more than one freezing cycle to preserve enough eggs?
Say the same.
Do I need to do more cycles if one cycle is not enough?
Some people will need one cycle, and some people will need more than one cycle, depending on how many eggs they make each cycle.
Okay. So how should I use my frozen egg when I'm ready to get pregnant?
Well, when you're ready to get pregnant, which will mean at that time that there is sperm available, so you'll have a partner, or you will get married, or some people will be single mothers and they will use donor sperm to get pregnant. We will thaw the eggs, we will fertilize them, and we will grow them in the lab in the form of embryos after they're fertilized, and then we will decide how many embryos will need to be transferred.
No.
If we again for the future.
Okay, patient asks how much is egg freezing cycles. So one cycle right now you can have a discount price is 5,500. So whoever attend this webinar today, you can contact us to get a discount price of egg freezing. Yes. Okay. So let's see. I think patient have one more question. What are the chance of getting pregnant with frozen egg? What are the success rate? Maybe she means.
With the new technology of vitrification, the way we freeze eggs, well, we were freezing eggs this way for years now, but vitrification is very good in freezing the eggs, and we get a very good survival rate when we thaw. Around 90% will survive. Pregnancy from frozen eggs is still a little less than from frozen embryos because the egg is the largest cell in the body. It's slightly more difficult to freeze technically than an embryo where there is very small cells. But the younger you are, the higher the pregnancy rate with egg freezing.
Okay, patient asks where the office. Global Fertility and Genetics is in Midtown Manhattan on 52nd Street between Lexington Avenue and Park Avenue. So we are not only a reproductive center, we also have our lab with CLIA and CLAP license. We also have the storage room. You can storage your eggs in our storage tank. Yes. Okay. Do you have a lab on site?
Yes, yes, we do.
Yeah, we have the best lab.
Yeah, everything is present in the same facility. You will have the consultations, the monitoring for the cycles and the retrieval, and all the procedures will be done in our lab on the facility.
Yeah. We have full service. We are not only doing egg freezing, we do everything like donors, IVF cycles, IUI, and we are full service in reproductive center. Okay. Will you take insurance? Yeah, we take a lot of insurance. Yeah.
Yes, I mean, we take most of the insurances that will cover IVF or infertility services.
Yeah, so yeah, we are not only taking insurance, we also have a loan program. So if you want to decide to do the egg freezing today, but you don't want to pay, it's okay, you can pay in future. So you can contact us to ask about the loan program. Yeah, egg freezing is only cost 5,500. It's a discount price. Okay, next question. What should I pay attention to before frozen my eggs? What they need to do before prepare? I think what she means, what she should prepare before egg freezing.
Well, keeping healthy, having a healthy lifestyle is important for everybody, and probably it is good also if you're doing a medical procedure, but most important is making the decision what you want to do and how important it is to preserve fertility.
So at what age should I consider freezing my eggs? The age problem.
This is a very difficult question to answer because everybody has different circumstances. The best time to freeze eggs with the highest results is between probably 25 and 35. Many of us have very active lives, we are very busy, and time flies, especially in a city like New York. Many of our patients are over 35, and also a significant number is over 40. This does not mean you cannot freeze eggs. Sometimes we need to do more than one cycle, sometimes the success is a little lower when you're in the older age bracket, but we still can help a lot of our patients have a family.
So this means we encourage the young people to storage their egg as soon as possible?
Well, I think in the future it will be routine probably to store eggs and probably sperm for younger people who are not ready to have a baby, but will desire a family in the future. So this is getting more and more popular, and it probably will be a routine process in the future.
Interesting. Okay, one more question. If I'm already on birth control pill, do I need to stop taking it in order to freeze my eggs?
We only will stop it then when we start the egg freezing cycle. So you can continue taking the pill, have all your evaluations done, and then we will stop the pill before we start the medication to grow the eggs.
Okay. So if I have IUD, do I need to remove my IUD in order to freeze my egg?
If the IUD is a medicated IUD, if it has progesterone in it, we usually will remove the IUD before the egg freezing cycle. Sometimes these IUDs will interfere with ovulation. But if the IUD is a Paragard or Kappa IUD, we don't need to take the IUD out.
Okay. What is the difference between freezing eggs and embryos? Freezing eggs and embryos.
Well, egg freezing is freezing the egg before fertilization. Freezing an embryo, you have to have a sperm from a partner or donor sperm. We will fertilize the egg, and we will grow the embryo for maybe usually to day 3 or day 5, and then we will freeze it.
Yeah, freezing eggs and embryos. Because some patients, they can make decisions. They want to freeze their embryos and they want to freeze their eggs. They can make decisions. Some like single young woman.
Well, it depends on the circumstances, if there's a partner available or not. If the patient is not sure, then we can always freeze the eggs because they can use any sperm in the future. Some of the patients will choose to use fertilize part of the eggs and freeze part as eggs without fertilization. So it really depends on the circumstances and what my patient wants.
So patient asks, when can I start the egg freezing cycles?
Do you mean in the cycle? I mean
when
during
she's supposed to start, like day 2?
Yeah, usually we will start the cycle on day 1 or 2 or 3 of the menstruation start in the cycle itself.
Yeah, so one more question is, how long my eggs could be freeze, like storage?
There is no time limit. We can freeze the egg forever.
So if I don't use my egg, can I donate in future?
You can, definitely.
So is egg freezing different from egg donation?
Well, egg donation means somebody will give the eggs to another person to use. Egg freezing, you usually will freeze the egg for yourself. But sometimes donor eggs are also frozen and can be used at any time for the recipient. So you can freeze donor eggs, but usually people will freeze the eggs for themselves.
So is the egg freezing different than IVF? What's the difference?
Well, usually in IVF we fertilize the egg and do a transfer of the embryo or freeze an embryo. When we freeze eggs, we don't fertilize, and the egg is frozen without fertilization and will be fertilized in the future. So IVF will be done in the future, And the egg will be fertilized in vitro and then transferred as an embryo.
Okay. So if I store the eggs in global fertility in future, I want to transfer to another place, can I do that?
Yes, you can. You have a right to transfer your eggs anywhere you want.
Any risk to transport my eggs is gonna be damaged?
I think that, if there is a risk, it's very minimum because we have good protocols in place and usually we can transport eggs without a problem.
Okay, welcome new people join. Okay, so what other questions we can talk about? I think we.
Why don't you see what the audience is asking?
What are you interested in, Abby?
Hmm?
New audience just join. Yeah, I think we answered a lot of questions. We go over a lot of questions today. So egg freezing is very interesting topic. It's getting more and more popular. I recommend all the young ladies. So it's better to freeze your eggs. It's not expensive. It's almost similar like some Gucci bags, right? But in future, your eggs gonna be really, really valuable because after our age getting 40 years old, we don't have too much good eggs. So freeze it early and you can get a better result in future. Okay. Are there any side effects? I'm just worried. Yeah, she's still talking about the side effects.
I think the side effects from the medication and the process is really, really slight. So there is no need to worry about the side effects itself. The hormones you are taking are taken for a very short period of time. They will not affect your body in any way in the long term.
Yes. No, not that much side effects. Patient always worry about side effects.
Well, side effects are important, but this process is fairly safe.
Yeah. So, any question you want to add, or anything you want to talk?
Well, I think the most important thing is making the decision, because when we're young, we feel we have all the time in the world, and this is the best time to freeze. So the decision is very, very difficult to make. But I think this will be a routine that people will be like preventive medicine for infertility, that everybody will think about, freezing the eggs when they're young and have the chance to use them in the future to have a baby.
Okay. Dr. Z, how many patients you already seen for egg freezing?
In my life or
in your life?
I don't think I have a number on that. I've been doing this for too long.
Like millions?
Hmm?
Like 1,000 millions?
Probably I saw thousands of patients.
Thousands of patients. Wow. A lot of people freeze their eggs.
Well, not all of them are egg freezing, but thousands of infertility patients.
Yeah. Okay. So I will talk one more time if she said in a year how many egg freezing people we have.
Well, the percentage of people who are freezing eggs and doing IVF in our place is probably now 50-50. So we have a significant number of patients that will freeze the eggs, and it is increasing all the time.
So what is the average age for the people who freeze their eggs?
The average age is probably around 35.
35.
It's about 35. We're getting more and more patients that are 40 or above 40 right now, as the information is there and people want to take advantage of the technology. But usually the best results are when you are younger.
So we will do more program and live webinars so people can know what is egg freezing. Maybe in future we can get the younger people who already freeze their eggs. Okay, what's the best way to contact you? Yeah, you can contact us by our website, Instagram, follow us on Facebook. You also can call us directly through our phone. You can tap your question to Instagram. We could answer you anytime. So anyone speaking Spanish and can help. Yeah, we have people speak Spanish, Mandarin, Italian, right? What do you speak?
Arabic.
Arabic, yeah.
Russian.
We have Russian.
We
We have 5 or 6 language here. Okay. So I will tell one more time of our fee schedule. We have egg freezing discount fee schedule 5,500. We also have a loan program, so you can do your egg freezing today and you can pay in future. So if you have more questions, feel free to contact us. So wish everybody have a good Friday night. Thank you for your time to join us.
Okay, guys. Good luck.
Good luck. Thank you. Good night.
Good night.
Yeah, bye.